Good morning and welcome to COVID-19 Talk with Local Health Authority. Joining us from Harris County is Dr. Erica Brown. Uh, from the City of Houston, Dr. David Purse. Special thanks to past President of Rotary Club of Houston, Kathy Finninger, for providing us the question. And to Morgan Ash, our producer. I'm Stephen Williams, the Director of the Houston Health Department. Been away for a couple of times, but glad to be back with y'all. Still have a lot of questions around COVID. It looks like things have died down, but we still have questions. When will Moderna's bivalent vaccines be available? Have trials documented its success?
So I don't mind taking that first. Moderna is in the process of running clinical trials. It looks like there may be something in the early summer, which is in the next couple of months, which means that it could potentially be available in the fall once it goes through the appropriate process. The bivalent vaccine would include protection against Omicron and Delta. This updated booster combines the original vaccine formula with mutations found in the beta variant or the B2 variant that we're familiar with. So we're excited to see what that potentially looks like.
So is that potentially going to be a booster?
Is it for those who have already received primary series? Everything is a booster at this point. So yes, I would think. Although, again, we don't have any definitive information, but I would think that the recommendation would be that for those who had a primary series to get this booster, I would be interested to see for those who would be nascent to what the recommendation is going to be, whether it would be this new bivalent or not. But again, it's still in clinical trial, so nothing has been decided.
Speaking of boosters, the results from the fourth dose do not seem to offer long-term protection, I guess they're saying. So should we just book a shot every 6 weeks, or are you hearing about a long-lasting vaccine?
Yeah. So good question. And actually the FDA's advisory panel came out and basically posed almost the same question is, we need to have a better strategy than just boosting every 6 to 8 weeks. And so this is where the issue of the new vaccines that are more broad spectrum are coming to play. And so like the bivalent that Dr. Brown was just talking about as an example. And this also kind of goes to the fact that, every year with the flu shot, it's a different formulation. And so it's entirely possible that that's where COVID will wind up a few years from now, is that we'll be getting an annual shot, or maybe it'll be a shot every couple of years, depending on how much the virus mutates. So at this point, the fourth shot is available. And I would say that for those folks that are over 65, and especially for people who've got a compromised immune system, so again, we're talking the organ transplant, chemotherapy, people who've got known immune system problems. If you've gotten your first booster, those are the folks who probably need to seriously consider getting the second booster. But the group that I'm trying to get a lot of attention is we've got a lot of folks in our community that got their first series and never got their first booster. And one of the things that's real clear is that first series is great against Alpha and Delta, but not so great against Omicron. Well, Omicron BA2, that's the one that's in the community now. So if you want to be protected against what's circulating in the community today and you didn't get your first booster, I would suggest you go get your first booster. And we'll worry about what's going to happen next year over the coming months.
Anything new regarding getting kids under 5 vaccinated before school starts in the fall?
So this is perfect timing. This morning, Moderna just announced that it is asking for emergency use authorization for the vaccine to be used all the way down to the age of 6 months. So depending on whether they receive that authorization, it should be readily available in the immediate future.
Great. Our world data shows the U.S. is very low on boosters received list and well below Germany, UK, and France. Are you seeing much resistance to getting booster number 2? What percentage of our area has received it?
Yeah, so I don't have the number for the city of Houston. I should have looked that up, but I don't have for the getting booster number 2. But it is true that even getting booster number 1, there's still a lot of room for improvement there. There's a lot of folks, I mentioned this just a moment ago, we got a lot of people who got their first series and never got their first booster. And of those who got their first booster, an even smaller number, obviously, have gotten their second booster. But right now, I would really encourage those folks who haven't got their first booster to go and get that, because that will protect you against the virus that's circulating in the community today, no matter who you are.
The time following exposure seems to change by the variant. I found one source that said it's between 5.6 days after contact to day 12, and another said 2 to 4 days. Can you explain how long we need to be cautious?
So we always need to be cautious. So there, the explanation to that, we always need to be cautious. The reason that you're seeing varying timeframes is based on the variant that you are looking at. So for instance, the Delta variant, right? The peak was about 5 to 6 days. The Omicron variant is more contagious, but seems to be less severe. The peak is in 1 to 2, 2 to 3 days. So again, the reason you're seeing differences is based on the variant that you're looking at.
Does COVID raise blood sugar levels?
Yes, it can. And we're seeing that it's, so folks that are previously diabetic are having problems with COVID, and people who weren't diabetic, there's some who are developing some characteristics of type 2 diabetes. So yeah, one thing about this virus, it will impact any organ system it chooses to. We've seen problems with pancreas and diabetes. We've seen liver problems. We've seen intestinal problems. We've seen lung problems. We've seen heart problems. We've seen nervous system problems. We've seen skin problems. We've seen joint problems. This virus will impact almost any organ system at once. And so, yeah, it can raise blood sugar values, and sometimes it can do so dangerously.
I've been over COVID for a while and was initially fine. After a few weeks, I started getting severe fatigue that continues 4 months later. Is this unusual? What specialty type doctor should I see?
So unfortunately, let me preface by saying you should always seek care from your primary care physician or from your physician to figure out what's going on. However, sometimes these symptoms can be a factor from long COVID. There are clinics at all of our major health systems now, including Methodist, Baylor College of Medicine, UTMB, Harris Health, et cetera, where they have a long COVID clinic. But the first stop is your primary care physician to make sure that there's nothing else going on.
Is it true that COVID viral infection remain in the gut for more than 6 months?
Yeah, so the answer to that question is yes, it can. It doesn't usually, however. Most people, we're monitoring the wastewater very carefully, and so that's one easy way for us to, across the population, across the community, to detect how much is in people's guts. So it can, but that's not a common thing. Usually it clears up with your symptoms, but it can remain in there for long periods of time. And like I said a minute ago, this virus breaks all the rules and can impact any organ system any way it appears that it wants to, apparently.
Mask mandates were overturned by a federal judge. Are local jurisdictions able to make rulings based on local conditions?
Yes, they are. So as you've seen, the county and the city have had mask mandates in the past that were not in alignment specifically with other state officials. However, at this time, it appears for us that we feel comfortable from a county perspective, and I won't speak for the city, but from a county perspective, that we're not needing to require masks at this time. We still carefully monitor all the numbers, and while we do see an increase in the infection rate, we're not seeing an increase in hospitalizations and severe illness. So just this morning, again, this is perfect timing for this conversation. There were some experts on the news, and finally ready to announce that we are moving into endemic state. That being said, we're moving into a place where we need to figure out how do we live with this, similar to when we were introduced to the flu, when we were introduced to other viruses. How did we learn to live with it? So long story short, yes, local government can mandate masks and does have jurisdiction to do so. We don't feel at this time that it is necessary to do so, but we carefully monitor to make sure that we're keeping the community safe.
What are your thoughts about U.S. DOJ and CDC appealing to a district court decision to eliminate mandated mask on public transportation corridor?
Yeah, so I'll give you my opinion on this, and Dr. Brown, you feel free to give your opinion on it too. But I think it's important that the CDC retains its authority to be able to implement things that protect the public at large. And this mask mandate reversal by this federal judge puts that at great risk. And one thing, and I'm just going to go off on a bit of a tangent, and forgive me, but I'm old enough. I remember going to school with classmates of mine who suffered some of the horrible impacts of polio. And Omicron, COVID has killed a lot of people. But they tended to be older folks, and they tended to be people who had chronic illness, but certainly not all of them. In the Houston Fire Department, we lost 3 healthy at-work firefighters to COVID. They are dead as a result of this virus. But as a society, we have, throughout this whole thing, there's been a big segment of society who has felt that this is not that big of a deal, and what are we worried about? That was not the feeling when I was a child and children were suffering from polio and wound up with just terrible disabilities for the rest of their lives. Society had a completely different view then. And so it's concerning to me that a federal judge is potentially stripping the CDC's ability to do that based on this illness, which perhaps maybe by comparison to polio was not as bad. But when the next thing comes by, which is as bad as polio, and we've tied the hands of the CDC, we will all be greatly regretting this decision.
So David, I'm going to chime in and support that. From a public health perspective, again, we're both public health departments. It is imperative that the experts, that being the CDC, which we have given authority to be the expert, have the authority to dictate, and I do use the word dictate purposefully at times, the needs and dictate what we should be doing as a country to keep our population safe. I too have great concern where we, and I'll just say it from my soapbox, where politics get in the way of the health of the community. And I do think that if we continue to go down this road, it will be unfortunate for us in the long term.
Is there any benefit at all to wearing cloth masks?
So let's say this, any mask has some benefit, but it's already, it's been shown that the cloth masks, because of the ability of particles to move through, is not the best. So we've well established that the N95 or the KN95 masks are the best. But again, any mask, if that's all you have, has some effect.
Philadelphia and other cities return to mask wearing. Do you think we will do so here?
I'm not predicting that. I'm not foreseeing that. And Dr. Brown mentioned earlier with a similar question, and we've joked that if you want to make a mistake in this line of work, make a prediction. So let me go ahead and make a prediction. So my prediction is that we're seeing the wastewater numbers come up. We're seeing the positivity numbers start to come up. We're not really seeing hospitalization numbers going up, but I think that we will, because most of the people that are being hospitalized today that are testing positive for COVID are being admitted for something else. So as more virus spreads across the entire community, the number of people going to the hospital, whether it be for their appendectomy, for their renal failure, for their other non-COVID related issue, we're going to see more people testing positive for COVID there, just as a consequence of it being in the community. That's different from more people being admitted to the hospital because of COVID. So I'm hoping that we won't see that. We might see a little bit of it, but certainly it will likely stay within the bounds where the hospitals can handle. And so for that reason, I don't anticipate we're going to see any more of the non-pharmaceutical inventions like, canceling large gatherings, mask wearing, all of that stuff. I don't anticipate that.
Okay, I see Morgan is anticipating our next question. What can you tell us about expanded use of and availability of Pfizer antiviral Paxlovid? Who should take it? The Boston Globe reports a rebound of symptoms after 5-day course of treatment and after initial negative cases.
So there's a few pieces to this question. As you see, there are plans to expand access to Paxlovid. It is authorized for under emergency use for those who are 12 and older who are at high risk for severe disease. It's available only by prescription. So again, the provider is the best one to determine whether it's right for you. So as far as the symptoms after a 5-day course, there have been reports about that, and there are studies being done about that. So I really can't answer more than yes, there have been reports, and yes, they're looking into what are the cause of those reports that have come about. There have also been reports about positivity after their initial negative cases. So again, research is ongoing. There are going to be parts of this virus and this pandemic for a long time to come where we're seeing something new and there has to be research done. I think it's going to be quite some time, years even, before we have a complete understanding of what happened, how it happened, and what's the best course going forward. But please don't mistake that for us not feeling very confident that the best course for right now to move into endemic state is vaccination.
Are kids now approved for remdesivir, and when should they take it?
So yes, infants who are at least 28 days and weighing 7 pounds may now receive the treatment. Who should take it? Obviously, you have to be hospitalized, have mild to moderate COVID. And so again, this really is at the discretion of the clinician who's treating the hospitalized patient, but it is authorized for use down to 28 days and 7 pounds.
Okay, this is gonna test my skills at pronouncing drugs. Any new information on sabizabulin drug?
Pretty good.
Yeah. Yeah, we agree. That's how to pronounce it. Just exactly the way you did. So I'll take this. So sabizabulin, if you say it really quick, it sounds like you know how to say it. So there a phase 3
syllables, David. I wanted to get all the syllables.
So a phase 3 trial, which is, there's phase 1, 2, and 3, and then it goes to market. So phase 3 trial was done. It actually got stopped early because the medicine was appeared to be really effective in reducing the death rate by as much as 45%. And so they're going to be moving forward with a request for the emergency use authorization. But in the meantime, a couple of questions have come up. And one was that in this study, they found that in the group that was getting the medication, that they dropped the death rate to about 20% from, I think it was from 45%. And now the questions are coming now is, well, what group was it that these were being used in that had such a high death rate? So there are now some questions coming back about the original study. And so that may be why we've not heard so much. But those questions will get answered. Seems to have high promise, and we're just going to have to wait and see. But the early data is very promising, but there's a couple questions about the study.
One group of friends canceled a trip to the U.S. for fear that they would have to quarantine upon their return home. Some airlines are not requiring masks, and some companies want proof of a recent test from their employees. Is there any effort being made to standardize at least travel requirements?
So I'm going to link this question back to a previous question about jurisdictions. That's really what it boils down to. So while we all, myself included, right, may be frustrated with on this level, we have to do this, on that level, it may be something different, and it can be confusing. Unfortunately, it really comes down to jurisdictional authority. And so at this time, no, there isn't any effort because internationally, federally, state, local, all have different jurisdiction, different authority to make those judgments.
If many
Stephen, I think you're on mute.
We lost your audio. Yep, you went to mute.
There we go.
Somebody muted me. Morgan must have. If many people around the world are not vaccinated, can we ever get over this pandemic?
Yeah, good question. And the part of the part of that question is, how do you define when we're over the pandemic? And part of it would be when the World Health Organization says it's no longer a pandemic. But here locally, and going to the comment that Dr. Brown made earlier, and from what we're seeing nationally, is that here in the United States, it becomes endemic when, well, there's probably a bunch of different definitions, but I think locally, when it's not causing a huge burden on the hospitals that they can't handle. So like the flu is endemic. We wind up with people getting hospitalized every year with the flu. We wind up with people dying every year from the flu, but it's endemic because it's, the numbers are not huge and it doesn't impact the rest of the healthcare system. And I think that's what we're approaching. Now, the other part of this question is, with large parts of the world not being vaccinated, that means the door remains very much open to yet another mutant coming on and setting us back to square one again. If that happens, we'll be far from being over the pandemic if we keep creating new mutants.
A related question: about 65% in Africa have been infected. Have they reached herd immunity yet?
It's hard to say whether they have herd immunity. The concept of herd immunity has changed recently with the rise in breakthrough infections. Some people have experienced severe illness and or death from reinfection. So the good news is that many people who have been infected and recovered are showing some level of immunity, but it's hard to answer that question and to really say whether there is herd immunity yet. I think David's answer in the last question is really the key. We are in a wait and see.
What is the status of COVID infections in our area?
So we talked about this a little bit earlier. The wastewater numbers are going up. So we know for a fact that there is viral spread occurring in our community. The positivity rates are going up slowly. And of course, they lag behind wastewater. That's exactly what we're seeing. Hospitalizations usually lag behind the increase in positivity rate. So it may be a little bit too early to see that. They are really pretty flat, maybe a little bit of an uptick in the in the TMC numbers, but the SETRAC numbers are really, really very flat. We've been about the same for about 3 weeks now in the number of people admitted to the hospitals, and most of those are with COVID, not for COVID. But again, it may just be a little bit early to see an increase in that. So it's here, it's spreading, but it doesn't seem to be making, anecdotally, we're hearing about a lot of people get sick, test positive, stay home from work, and then they go back a few days later and they're fine. So we'll have to wait. So is that endemic? Maybe.
Was the spring break impact this year less than the previous two?
I wouldn't, the impact, yes. Can we say that the number of cases was less with home testing? We see the numbers are lower, but with home testing and not necessarily knowing all of the positivity rates of home testing, we can't really say that for sure. But the impact definitely was yes, and we continue to see the numbers decline over the past few weeks.
BA2 is 68.1% of the total cases. BA 2.1 wave is up to 29%. Can we figure all new cases are that variant?
I don't think we can say all. It's a strong word, but most. We can say that BA2 is the dominant variant at this point.
Looks like there is a slight increase in hospitalizations. Why?
So this goes back to a comment I made earlier, and we need to pay a little bit of close attention to what we're talking about. So as more and more people in the community are testing positive for COVID, then that the people going to the hospital are just a sample of that. So if people are going in because of their appendicitis, their renal failure, their other non-COVID illness, if there's more virus spreading in the community, then more people getting admitted for non-COVID things are going to test positive as well. So that's why it comes down to, are they being admitted with COVID or are they being admitted for COVID? And what the people in the hospital tell us right now is that nearly everyone, not everyone, but nearly everyone is being admitted with COVID as opposed to for COVID. So again, I expect that we'll see an increase in that number following the increase we're currently seeing in positivity, which is following the increase we've seen in wastewater.
How much do at-home testing results impact how we perceive COVID in our community?
So this is a great follow-up question to the last. The way that we are measuring, and we have used this measurement for quite some time, even prior to such easy access to home testing, is the hospital rate. as well as the positivity rate from those formal tests that are done in a lab somewhere, as well as the wastewater data for our community. But again, we should note that the burning question here with the hospital data is those who are admitted for COVID versus those who are admitted and happen to have COVID upon admission.
Maybe a related question. Overview of TMC ICU bed capacity and occupancy looks high to me, but when you see the small number of beds occupied with COVID patient, it looks great. How should we interpret this?
I think we've alluded to this in some of the previous answers. We still, unfortunately, continue to have people who require ICU care. And so while we may see ICU bed occupancy being up, those that are specifically in the ICU because of COVID, those numbers are low.
Mm-hmm. Who is least likely and most likely to get a breakthrough case of COVID?
Yeah, that's a good question. And part of it goes to how do we define breakthrough? One of the mistakes I think in hindsight that we made is that anybody who tested positive after getting vaccinated, people were labeling that as a breakthrough. Well, that we shouldn't have done it that way, because you get the flu shot, and if you catch the flu, you should happen to catch the flu. That doesn't mean the flu shot failed. If you catch the flu and you don't wind up in the hospital, that's a vaccine success, not a breakthrough, not a failure. And so that's one of the problems I think that we have with breakthrough. But those people who have impaired immune systems are the ones where the vaccine is least likely to have its best impact. And so I would say those, to answer this question, the people who've got impaired immune systems, again, people who know their immune system is impaired, organ transplant, chemotherapy patients, the elderly are the ones who are, the vaccine is more likely to have less protection, and therefore should get the boosters.
Two wastewater questions. Looking at wastewater crystal ball, what's next? What else does wastewater predict?
So I'll take that one, since the wastewater is predominantly a city thing. And so we're looking for variants. And here's the other thing. While wastewater is new to the public, we've been looking at wastewater for other diseases for decades. So the whole concept of looking at wastewater for illness is not necessarily new. It is broad ranging. There are some communities in the United States that are looking to find out which neighborhoods they've got more opiate use, and helping to direct their, about the huge opiate problem we have in the United States today. We're able to find certain funguses that are infecting. There are certain funguses in nursing homes that are causing serious problems, so we can look for those funguses in the nursing homes. There's a broad range of things that we can look for. And so I think when we say about what's next, this COVID pandemic has created the wastewater testing industry and science to blossom so much that I anticipate we'll be using it to find a whole lot of other issues that are currently impacting communities as we move forward.
Thank you for joining us for COVID-19 Talk with Local Health Authorities. Dr. Erica Brown, representing Harris County, Dr. David Purse, representing the City of Houston. Special thanks to past President Kathy Fenninger, Rotary Club of Houston, for providing the questions. Our producer, Morgan Ash. I'm Stephen Williams, Director of the Houston Health Department. See you next time.